host, Jumi. Excited that you all are here again on this beautiful Thursday because you are in for a fabulous episode. I know we normally have a lot of people tuning in from a lot of different places all over the country. So please let me know where you're tuning in from. Put it in the chat, whether in the East Coast or the West Coast and all the wonderful states in between. Let us know where you're tuning in from because we've got guests today that are coming to you from all over the country. And I'm really excited to get started. As you know, we have been having some really great conversations each week about women's health topics and just different topics that impact our everyday of reproductive age, and that is fertility. We are talking about fertility with a couple people who are here to share their stories. It's going to be kind of like a sister circle today. We're going to have really engaging dialogue, interactive conversation. And to get that started, I would love to know, and if you can watch tail at all, but just put in the chat, put a simple yes, and let people know like what you know, what's your experience, or what somebody you know, what their experience have been with fertility. Because we are going to jump right in and talk to share their stories. I know you don't want to hear from me about that. So I'm going to start now and introduce our first couple of guests who are here to talk about their particular fertility stories. So our first guest is Jocelyn Jackson. People recover a sense of happiness in their life and helps people heal from their traumas. She was told many times by different doctors and nurses that because of her advanced maternal age, that she may have to tell us that story. And she's actually got a special guest with her today. So first I would like to introduce Jocelyn Jackson Williams. Hey, Jocelyn, and we have a little favor here with
my special guest. This is Jonathan. He will be with us for our time. He's a part of the story, so we might as well, you know.
Guest is Jonathan. So before she tells exactly, I love it. Hey, Jonathan.
His name, he has no. This whole computer thing is like what he's like, I'm almost 4 months old. I don't understand about this online stuff quite yet.
He'll be okay. Well, we want to bring on Stacy as well to introduce her real quick. And so she is somebody who also was told, had her own fertility story, and she got married late. She got married at 39 and she ended up having a baby at 47 years old. So I would love to introduce Miss Stacy Andrews. Welcome to the show, Stacy.
Thank you.
I'm so happy that you all are here. I'm so happy that you all are here. Thank you so much for taking the time today to join us and talk about your fertility stories. I would love to get started with you, Jocelyn, so you can tell us more about your journey to having this beautiful baby boy who is sitting on your lap.
Absolutely.
So go ahead and tell us your story, Jocelyn.
Okay, great. Yes, my name is Jocelyn. It's so funny that you said Stacy got married late at 39. I'm like, that's early. I got married at 45 for the first time. And so my husband and I decided we would start trying immediately. So we started on our wedding night, and a few months in, I wasn't pregnant, and then started realizing about 6 months of trying, like, okay, something's going on. But typically, at least we were told, depending on what doctor you see, they may tell you something different, but we were told we would have to try for a year before they would consider it to be infertility and go down that route. So we did. We tried for a year, and I think that one of the hardest parts in that part of the journey was, at first I was each month just disappointed and heartbroken that I wasn't pregnant. But there came a month where it kind of shifted, and I just expected to not be pregnant. And then that broke my heart in a different way. But in the midst of all of that, we still continued because, we decided to have kids. when we were dating, one of the first things my, at the time, boyfriend gave me was a bib, just letting me know how serious he was for me and that, he wanted us to have a family together. So we ended up getting, having every test run imaginable, and everything came back normal. So they didn't see anything wrong with him. They didn't see anything that was particularly wrong with me. And but it also, at the time, neither one of us knew that we were both sickle cell carriers. So on top of trying to get pregnant, we find out that we're both carriers for sickle cell, and so there's that as well. And we in that process, we went to a bunch of fertility clinics, and a lot of them, because at the time I was 45, 46, they weren't really too happy about us trying to get pregnant. Some of them told me that, anybody over 42, they don't want to help. And that most of them just told me that I would have to get a donor egg. That would be the only thing that they would, be able to help me with. But we found a friend, a doctor friend who is familiar with some of the doctors at UCSF, and we ended up working with them. And I guess they still my doctor had to go to the board to get permission to try to see if I could get pregnant through IVF. And she did that for us. And we had to test, not only my eggs to see if I had viable eggs, because I knew I had a lot of eggs in quantity still, but we didn't know the quality of them. So they tested for that. And then they also we did genetic testing to make sure that Jonathan wouldn't have sickle cell disease. He ended up having the trait just like us. So we did a couple of rounds of IUI, which didn't work for us. And then we pursued IVF, and this little one is the result of that.
The little one, we love it. We love it. Well, thank you so much for telling that story. So what are some things that you feel like you wish you would have known before you started your own fertility journey?
Oh my goodness. I wish I would have known. I figured out along the way, I wish I would have known that how strongly I was going to have to advocate for myself. Because there's just not, I think some medical institutions have, they're kind of, this is what we do in this circumstance. And it's not very specific to necessarily the person and their situation. So I had to figure that stuff out. So it would have been great to walk into it knowing because I wanted this, is how strongly I was going to have to try to fight for it, just for the opportunity to try.
Mm-hmm. So what does it mean to advocate for your health? I know that you are a major proponent of women advocating for the health, but what does that look like?
I think it looks like you doing some research yourself on whatever the particular health issue is, but then knowing what you need. Because sometimes I think we look at doctors as the authority. So whatever they say goes, and you never question anything that they say. And you give up maybe sometimes what you would really like to see happen because somebody told you differently. So advocating for yourself is really knowing what you want and understanding the depths of that, and knowing, is it viable, or is it something that I can continue to pursue? And it's just this person who's not interested in it. Just really knowing the nuances of that.
So what do you think needs to change when it comes to fertility? Justin's like, I'm ready for this question.
Well, you and I have had this conversation offline before, so I know my particular answer.
Yes, but share. I want the people to know that they're watching and they might need to know like the struggles and what you encountered and what is not okay with the journey.
I just think the hard, fast rule is you can't, it's not a one size fits all. And I understand, like, I ended up I was 47 when we did the embryo transfer, and 48 when he was born. So I understand that that's maybe not necessarily common, but it's not impossible either. And I was told that it was impossible. So clearly it's not. So I want there to at least be some wiggle room in the conversations. Like I remember when they were trying, one of the doctors was trying to talk me out of it, and I said, well, you know what? I think perhaps the numbers are so low for women my age because we're just scared. Like I'm looking at the data that you're showing me and I'm scared. Like I feel like I'm crazy for trying to continue with this, but just letting people make the choice for themselves. Still, I guess, provide the data, but there are some people my age who are having babies, and that's the truth. And I wasn't told that.
You weren't told that. So, what advice do you have for women that are of advanced maternal age that want to go through the process, that might be scared, that might be feeling anxious about starting late?
I think I went through the same kind of mental preparation with this that I did when I was single, because I got married later in life. And there came a point where I was like, I really want this for my life. But if it doesn't happen, I have to figure out how to live my life believing that I haven't been cheated in life. And so I had to do the same thing with the process of trying to get pregnant and realizing that it was indeed a dream of mine. But I wanted to pursue it, but I knew that it may not happen, and I was going to be okay with that. Figure out how to be okay with it, but I needed to try because I felt deep down that I should try.
Yeah, and that's the important thing. It's just like trying and not giving up because somebody else says that you should give up because of reports or data or something like that. And you've got this beautiful baby boy who is so excited to be here with all of us.
He took his yawn like, okay, Mom.
Right. Well, Jocelyn, I'm so grateful. I really appreciate you, taking this time to tell us your story. I'm going to now bring up Stacy, and we're going to see another beautiful baby. And we're going to have Stacy tell us her story to having her beautiful daughter, who apparently has just woken up from a nap. So Jocelyn, we will see you in a second. All right. Well, Stacy, hello. Who is this beautiful baby?
This is Zolani.
Hey, little mama. All right. Well, Stacy, I'm super excited for the viewers to hear about your fertility journey. So if you could tell them about how you got to having this beautiful daughter of yours.
So my story is definitely a long one. This is 7 years in the making for this little one here. I got, married a bit late, at 39, and similar to Jocelyn, we started trying, and, I actually was able to get pregnant the first time on my own with no assistance, but that pregnancy ended in miscarriage. And so we, luckily my OB actually does do a bit of fertility treatments. So I was able to just do some initial things, just Clomid through my OBGYN, and got pregnant a second time, not too many months later, but lost that pregnancy in the second trimester. So that was actually quite heartbreaking because we had, made the announcement, gotten past what we thought was the danger zone. And ultimately they couldn't find any reason why that resulted in a miscarriage. We had the baby tested and he was fine. So we moved on to fertility specialists from there. And we started off with IUIs. I got pregnant again twice with IUIs, and those resulted in losses, one of which was really kind of on one of the doctors, for our very first doctor, which caused some major trust issues moving forward. So it was really a tough journey, to kind of like, you get kind of PTSD, after a while. But ultimately I was actually for the first or second IVF, I was with a doctor. Something was wrong after the IVF. I was having crazy cramping and bleeding. not around the time that I was supposed to. And I requested to see the doctor, and the nurses were just very lackadaisical about the schedule. They weren't, calling me back. You have to go in on a certain day of your cycle. It was a mess. And so ultimately I ended up seeing the doctor's assistant, and, she couldn't, she did a ultrasound and couldn't find anything wrong. Subsequently, I went to another doctor for a consultation for something completely different. And the first thing he found upon examination was, oh, you have a huge fibroid here. No, I'm sure that's causing you some, pain and other things happening. And that was the end of that doctor. And the doctor that actually, found the fibroid and did our next round of IVF, we were preparing to do our transfer, getting ready for that. And about a week after I kind of got my, my marching orders, I get a call from his assistant saying that we won't be able to move forward because he was arrested for his wife's murder. And so that was like a punch to the gut. We didn't know what to do. We were, after what we had been through so far, it was a really tough decision to make. We had already had, there were all these things going on with our lab already having, our embryos, and, having to find another doctor. And a lot of doctors don't like to work with embryos they didn't make, and, all of these things. So ultimately we found a doctor who was willing to, and hence we're here with this little girl.
Wow.
Yeah.
Oh, my goodness.
Yeah.
So what was it in you that you did not give up? Because that is not an easy journey to go through with all of those different things popping up, and you just you really had to trust the system. What was it about it that, you were really like, no, we're still going to do this. We're going to keep on doing this.
I decided two things. When I knew that we were going to embark upon this journey, I decided three things, really. I decided, one, I'm not going to let this process, no matter what happens, no matter if I have more losses. And this was after the second loss. I made a promise to myself and to God that I would not allow it to steal my joy for children, for mothers. I've always celebrated all the mothers in my life. And I also was not going to let it destroy my marriage, and that I wasn't going to give up. And that regardless of, whatever path to parenthood we chose, that we were meant to be parents. And I would just have to make my peace along the way with each of those steps. And that's kind of what kept me going. That and just faith and prayer, honestly.
That's real.
That is really the only thing that kept me grounded, kept me happy, and continuing to, choose joy. Of course, there were, plenty of bad days and disappointing days and sad days and all of that. But ultimately, I always, I chose to come back to joy so that I could keep going and just keep a vibrant spirit of motherhood in me and around me.
What do you feel like you wish you would have known before you started the journey? Like if you resources, advice, doctors, anything?
I definitely wish I would have known the financial component of it, which is huge if insurance doesn't cover it, and a lot of insurance does not. And really what the real true statistics are. A lot of doctors and clinics will take your money and, and not really, I wish I would have done IVF out the gate. We did a lot of IUIs, which we probably shouldn't have been doing. We should have done, IVF as soon as we had that second loss. And, that I definitely would have changed. But just knowing, being really and truly educated, because it's this whole world that if you have to research yourself, it is daunting. And it is, it is mind blowing. And there's so many things you don't understand, even just about the basic process of it,
Well, with that said, what do you, in addition to the cost, what advice do you have for women that might be going through it or thinking that they're having some issues? Like, what advice would you give to them?
Well, first, I would say even before you get to that point, I would say to anyone, to any women who are, in their 30s, and thinking that maybe they're single, maybe they're, not married yet, maybe their career, focused right now, whatever it is, freeze your eggs. If you even think there's the remote possibility, don't wait. I mean, I have plenty of friends who have had children in their 40s, naturally and everything, but you just never know what your situation is going to be. You never know how long it's going to take. Go ahead and give yourself an insurance policy and freeze your eggs. And the second thing I would say is, really do your research. Do your research on the doctors. Do your research on the lab. The lab is just as important as the doctor. So don't just go by, a doctor's success rate. Have tons of questions, and don't be ashamed to, to talk to people and ask questions. You're not alone. This is, 1 in 4, women and families have issues. And so this is something that you don't have to go through by yourself, and that you don't have to be ashamed to talk about and to ask questions, because you never know who's right around. You can be a wealth of information through their experience, through resources, through referrals, through many different avenues.
And you brought up 2 really good points that I'm actually really excited to talk to the experts about with regards to the insurance, regards to freezing the eggs. And so thank you so much for, bringing that up and telling us your story. I mean, that was an incredible testimony that you just gave. And we're definitely going to talk to you later on in the show. But first and foremost, I want to say thank you to both you and Jocelyn for telling us your stories. Everybody, I hope you're still with us. I hope you really did enjoy those first 2 personal stories about fertility, because what we're going to do now is I'm going to bring up these experts who are, experts in reproductive health that can help us really unpack what both Jocelyn and Stacey were going through. And so let me introduce our first guest. Our first guest is Dr. Mccarthy Keith, and she is a medical director at Shady Grove Fertility in Atlanta. She earned her medical degree from the University of North Carolina, Chapel Hill, and also a Master of Public Health in Maternal and Child Health at University of North Carolina. She completed her OB-GYN residency training at Duke University Medical Center and a fellowship in reproductive endocrinology and infertility at the National Institutes of Health in Bethesda, Maryland. During her fellowship, Dr. Mccarthy Keith's research focused on the molecular mechanisms of uterine fibroid regulation and reproductive health disparities. She has special interest in male and female infertility, polycystic ovary syndrome, uterine fibroids, and in vitro fertilization. Let us welcome Dr. Mccarthy Keith. Hello, Dr. McCarthy Keith. How are you?
Thank you so much for having me here. I am happy to be here. I'm doing well. Thank you.
Amazing. And so before we get started with you, I'd love to bring in our second doctor, who is Dr. Amatma. She is a board-certified naturopathic endocrinologist. She's been in practice for close to 15 years. She specializes in fertility. And is the best-selling author of a book called Fertility Secrets: What Your Doctor Didn't Tell You About Baby Making. She was awarded the Best Naturopathic Medicine Doctor Award locally in 2015 and 2020, and recognized also in 2020 as a top woman in medicine doctor. In addition to supporting, couples through individualized care, in person and virtually, she also trains practitioners who want to specialize in fertility. Dr. Amatma has been a featured expert on ABC, Fox, CBS, and KTLA, just to name a few. And now she is joining me on Jumping with Jumi. So I'm super excited to bring up Dr. Amatma. Thank you for joining us.
Thanks for having me. I'm so excited to be here. And what powerful stories these women have.
Right? Isn't that amazing? Like, I'm so excited that you all have been able to hear them. I mean, you hear these all the time, I'm sure, but like to have it in one place and then to be able to follow up and really tell us like what is really going on and help us understand all of these, situations that they were going through. And I know we hear fertility, infertility, we hear all these different words, but I would love to just start with the basics of when does a doctor diagnose you for infertility? Like how do you define it? Dr. Mccarthy Keith, if you could start us off with that.
Sure, I'll be glad to. And I also want to just say congratulations to Stacy and Jocelyn for your beautiful babies and your wonderful stories. And thank you for sharing those, because I think that in telling your stories, you really highlight several things. One of which is that fertility doesn't just stop abruptly. It is different for all women. And there are some women who are fertile into their 40s. And there are some women who experience challenges at younger ages. And so we have to be mindful of unique circumstances for everyone. In general, we define infertility as having regular unprotected intercourse for a specified period of time. And the time period is based on the age of the woman. So for women who are under 35 years old, we define infertility as difficulty conceiving after 12 consecutive months of regular unprotected intercourse. Because of the aging of our egg supply in our ovaries, we shorten that time frame to 6 months once a woman is over 35. Again, the change in egg reserve becomes even more dramatic in the 40s. So if women are unprotected and unable to conceive for 3 consecutive months and they're over 40 years old, then we suggest that they see a fertility specialist at that time and not wait 6 months or 12 months when they're 40, because the aging effects on the egg supply can be magnified once we're over 40, and we do not want women to lose their window of opportunity for having successful treatment or pregnancy.
So the age thing does matter to an extent.
It matters a lot.
It is a lot.
It is the big factor, yes. And it matters for women differently than for men. And so we have to understand that men's fertility does not follow a biological clock. So for men, sperm cells are produced on a rolling basis every 2 or 3 months. And that process continues until men are in their 50s, 60s, sometimes 70s, which is why we have all seen men who were those ages who fathered children. And so men a lot of times do not feel the time crunch and the age pressure that women feel when it comes to their fertility. But the basics is that for women, we are born with all the eggs we have. And so our fertility is changing from birth, basically. When we are still in the uterus, we have 6 or 7 million immature eggs in our ovaries. When we're born, we have 1 million left. And we do not produce new eggs the way that men produce new sperm in their lifetime. So from birth on, that million count of eggs that we're born with is gradually declining for all of us. It's a gradual, slow process, but that curve usually accelerates in the mid-30s and towards 40. And that's why we have those age cutoffs of 35 to 40 and over, where we start to see more dramatic changes in our ovarian reserve. And there's 2 factors. One is the number of our eggs is gradually declining, but the other factor is that the quality of our eggs is changing. Those eggs that we are still carrying and ovulating have been aging with us since birth. And so when we are in our 40s, our eggs are 40s. And so we are more prone to have chromosomal abnormalities with a pregnancy that can lead to miscarriages. And we know that those risks are higher when we're pregnant at those ages.
So what are some major causes of infertility? What are some health conditions that cause it? And is there always a cause for infertility? Dr. Matma, if you wanted to chime in with that.
Yeah, I think that endometriosis and PCOS are definitely leading causes of infertility. Not that every case has a cause, but those 2 definitely tend towards higher rates of infertility in women that have those underlying conditions. And then really from the naturopathic perspective, we kind of view it as there are so many different scenarios that are going on under the surface that can also relate to infertility. It's not necessarily like, hey, because you have high levels of stress, that's why you're infertile. But stress is shown, for example, to cause a harder time conceiving. Similarly, we could talk about toxins in our environment. That I feel like that's been on the rise for so many years, and simultaneously infertility has been on the rise. So there's evidence for this. And then there are a whole host of other endocrine disorders that also connect to harder time conceiving, not necessarily, again, a direct cause, but a factor that's at play.
So you mentioned endometriosis, and March is National Endometriosis Awareness Month, yeah?
Yes.
So I've heard, though, that it's one of those conditions that's very common, but it takes a while for it to actually be diagnosed. Like, why is that?
You know, there isn't a really easy way to diagnose endometriosis.
Okay.
If there were a lab test, more doctors would be likely to say, hey, let's just do this test so we know whether you have it or you don't. But unfortunately, it requires laparoscopic surgery. It is expensive. It's got side effects potentially, like scar tissue. And a lot of women, one of their only symptoms of endometriosis is infertility. So it's like they go through their entire lives and they're like, my periods are normal. I don't have extreme amounts of pain. I don't understand. Could this be endometriosis? And unfortunately, there aren't too many easy ways for us to say, oh, yes, you fall into the category. If you have intense levels of pain, absolutely, we should screen you for endometriosis if there isn't another explanation. But there is really that place of women without symptoms who still have endometriosis, who we would never know until there was a laparoscopic procedure to figure that out.
Wow. Okay. And so then with that, so endometriosis, but it can causes infertility. But then what also about like polycystic ovary syndrome and fibroids? Dr. Mccarthy Keith, I know that your research really heavily focuses on that. Or can you tell us how those two, like the difference between fibroids and polycystic ovarian syndrome and their impact on fertility?
Sure. As Dr. Mottler mentioned, PCOS is the most common reproductive hormone disorder that we see as gynecologists and as fertility specialists. And so PCOS is polycystic ovary syndrome, and there are specific features that go along with the PCOS. So polycystic ovaries have a very characteristic appearance on an ultrasound. We say it looks like there's a string of pearls around the edge of the ovary because there are follicles or immature eggs that are developing in ovaries all the time. And if the ovaries are polycystic, those follicles are kind of lined up around the edge of the ovary. So when we do an ultrasound, a lot of times we'll see those features that are consistent with PCOS. Even though there are more follicles or eggs in the ovary, it's very common for women with PCOS to have very irregular cycles where those follicles just kind of stall out and they don't develop or ovulate at all. If a woman doesn't ovulate, then she will go months without having a menstrual cycle, or sometimes the follicle will develop more slowly. So instead of her having 30-day cycles, she might have cycles every 35 and 40 and 45 days. So irregular cycles are common with PCOS. Another feature is that polycystic ovaries may make more testosterone. So many patients with PCOS have acne, oily skin. They might have facial hair or sparse hair growth on their chest and things like that. There is a metabolic component to PCOS, so weight gain, trouble losing weight, prediabetes, risk of gestational diabetes during pregnancy, or risk of developing diabetes in the future also go along with PCOS. So it's very common, but it's also common for PCOS to be missed. There is a spectrum where some women fit the prototype that's in the textbook. And they have the facial hair, the acne, very regular cycles, maybe overweight. A lot of times women will feel like if they don't fit that picture, that they must not have PCOS. And also sometimes providers will miss it because providers are also looking for that prototype and missing the subtle PCO patient who may be normal weight. She might have clear skin. Her cycles might be slightly irregular, or she might have very regular cycles, and they are still on that spectrum of PCOS. So if you have PCOS, ovulation is an issue for many women, and that can definitely impact their fertility. Fibroids are completely different from PCOS.
Yeah.
So fibroids are smooth muscle tumors that grow in the uterus. They are most often benign, non-cancerous growths, but they grow and they can get very large, and depending on where they are in the uterus or the pelvis, they can give symptoms of pelvic pain, pelvic pressure, pressure on the bladder where women have to empty their bladder, go to the bathroom more often, constipation sometimes, pain with intercourse, and they can definitely affect the menstrual cycles, making bleeding heavier or unscheduled, irregular, and things like that. What we know is that fibroids are very common, especially for Black women. So for Black women, by the time we are 50, about 80% of us will be diagnosed with fibroids. And we know that, it's size and location of fibroids that matters. Many women walk around and never knew they had a fibroid until they have an ultrasound or they have a pelvic exam and their uterus is enlarged. So they don't always give us symptoms. They don't always cause a problem. So even though 80% of us have fibroids, we don't have to intervene on every fibroid. It's only if they're large, they're giving us symptoms, they're causing infertility, that we want to intervene on those.
Wow. I mean, that's just a shocking statistic. The fact that so many of us are going to have it by a certain age, but we don't know, and that we don't know what we have until we have these issues. And then we have to come and see a specialist. And so I wanted to touch on something that Stacey mentioned when it came to, advocating for your health and trying to figure out the best specialist for you. What do you recommend when it comes to knowing whether to go, the way Dr. Matma, you are a holistic specialist, or just going like a more traditional route? What should a woman or a couple look for in a specialist?
I can take that one first. So I would say, first and foremost, I would look for someone who's willing to listen. And that seems really cliche or something, but I really believe that a lot of what I do and a lot of what I catch is half of it is just in the conversation, right? So, for example, I had a person yesterday, I just started working with her. She came in and she's describing everything that she's been on in her fertility journey so far. She's only 32, but it's been a long journey already. And I asked her, like, has your doctor, her lab tests were pretty patterned of PCOS potentially. So I was like, has your doctor ever done an ultrasound? And she said, oh yeah, absolutely. And I was like, so describe it. Did they find anything? And she said, well, they found this like classic string of pearls, but my doctor said it wasn't PCOS. And I had to pause and be like, this doctor found the string of pearls. As Dr. Mccarthy Keith just said, that is a classic sign, and didn't bother to work her up for the rest of the criteria that would help figure out whether she had PCOS or not. This woman has regular cycles. She's not obese. So she doesn't fit the classical picture, yet there was some signs. It's very likely that she's having anovulatory cycles, but no one bothered to work her up. So now this woman has been on a journey for 3 years through all types of treatment, because we don't know if there's some underlying condition that's actually causing it. So that my first piece of thing is like, find someone who's willing to listen and pay attention to what you have to say. You know your body better than your doctor. You've been in your body for how many ever years you are, right? You know your body.
Yeah.
So for me, if a woman says, oh, my cycles are suddenly irregular, my response is, oh, let's figure out why they're irregular. Not, oh no, that's fine, it's normal. It's not normal. If she's saying it's irregular, it's
It's
irregular.
irregular. Like, how you gonna tell me? My body is telling me that it's
Yes.
irregular. Like, I'm telling you.
Totally.
Okay, so Dr. Mccarthy Keith, what do you think are some things we should look out for, or what are some red flags if you see like a doctor, like would you be like, okay, no, not going there with that person?
I agree with Dr. Amatma. You really want someone who you connect with. You want a provider who you feel is listening to you, who is paying attention to your unique situation and not kind of looking for a cookie cutter, put you in a box type of situation. Like we just mentioned, if you're looking for with PCOS, you're looking for someone who came out of the textbook, you're going to miss a lot of patients who have PCOS who could benefit from interventions to manage their PCOS because you're kind of got your blinders on and you say, if you don't have every single criteria for PCOS, you must not have it. And so we're not going to focus on that or try to help you in that way. So it's really about your gut, just like with everything else. When you see any provider, you have to have a connection with them. You want to feel comfortable. You want to feel that they have your best interest. And also you just want to make sure that that you're being seen as a couple. If you have a partner, they have to include them in those conversations. And you really have to advocate for yourself. And we heard that from your initial guest with Jocelyn and Stacy. So if you see, even this starts with your OBGYN, it doesn't begin with a fertility specialist. And so your GYN has a perfect opportunity during your annual exam to just say, how are you doing? Are you thinking about having a baby?
Mm-hmm.
Are you thinking about freezing eggs? And it's just like a 2-second question. And if you say, nope, I'm done with children, I'm not interested, then you move on. But they have opened that door. And if you have questions, you've started the conversation and they can order testing for you or they can refer you. If your provider does not initiate that conversation, then advocate and you bring it up. And when you go for your checkup, say, can you check my fertility? I'm concerned about this. Do I have fibroids? Can you tell me if I do? Can you look for that? And you have to really be your own advocate and make sure that you're being heard.
And that's so difficult. Yeah, that's really difficult.
For what you just said. Like, it is so frequent that I find that women have been made to wait so long before they're actually getting tested. Exactly. And a lot of times we know that they have hormonal irregularities. We could probably tell just from talking to them, but they've been told like, oh no, we have to wait 12 months. We have to wait 6 months. Just go get the test yourself. Like, there are so many at-home test facilities. Like, they'll ship you a kit. You can ship it back. Really simple. Like, just.
But we don't. The thing is, it sounds simple, but we don't know this. Like, we don't know where to find it. We don't know where the information is. And so, hearing this from you all to say, it's so simple to get tested, to tell the doctor what it is that you want. These are the kind of I wouldn't know to test myself or to say that this is what's happening. Like, I only know how I'm feeling. And it's usually I'm usually not feeling well before I go to a doctor for that. But you did mention something and something that Stacy also mentioned when it came to advice that she would give. Let's talk about egg freezing, because in my 20s, I was not thinking about freezing eggs. That didn't even cross my mind. Didn't even hear about it. What is your advice for people who don't want to have kids quite yet, but know that this is an issue, a potential issue?
I say do it. And I want to go back and I just freeze your eggs, freeze them. I want to go back and just say that, we say wait 12 months, 6 months, or 3 months. That is if there's nothing else going on. If you have irregular cycles, if you have a period twice a year, if you've had infertility with a partner before, if you know you have fibroids, if you've been diagnosed with endometriosis, don't wait a year or 6 months or 3 months. If you already have a diagnosed factor, seek help for that factor. Those guidelines are just general framework if there's nothing else going on. But if you have an obvious factor, your tubes have been tied, your partner's had a vasectomy, any of those things, you just want to go ahead and see the specialist. Now, back to freezing eggs. Please freeze eggs. So I like to joke and say that I would like to screen print a t-shirt and just, I'm in Atlanta. I want to walk through Lenox Mall with a t-shirt that says, ask me about my age and my fertility and my egg supply. And I just want people to come up and talk to me about it, because enough of us do not understand. We did not get the education about the curve of your eggs. And Dr. Mottman and I see women who come in who are already on the other side of the curve where the conversation is different, and women can get pregnant at those ages, but they may be challenged and they may not get pregnant as often, or they might have more miscarriages before they get there. And so the curve for our egg supply is real. And so if women are not ready to be pregnant, and many of us have spent most of our adult years focusing on education and career and establishing ourselves and making plans for that, you have to plan for your fertility in the same way that you plan for the other aspects of your life. And so if you're in your early 30s and you're not ready to be pregnant, then freezing your eggs is a great opportunity for you to store those eggs at a younger age. And the benefit of freezing your eggs is that your chance of pregnancy is based on the age when those eggs are collected and frozen, not the age when you put them back in your body. So if you freeze your eggs in your 30s, they're locked in at 30 something, however old you were when you froze them. And then you can come back and be 45 or 50. If you thaw those eggs and you fertilize those eggs and transfer that embryo to your body, regardless of your age when you put the embryo back in your body, your chance of being pregnant, the risk of miscarriage, and the health of the embryo is based on the age when you froze. So we do encourage young ladies to freeze your eggs if you're not ready. And it's an insurance policy, like one of our earlier guests mentioned, just a backup plan, so that if you get to an age where you're challenged, you have eggs that were stored at a younger age that you can fall back on.
So what if you store your eggs, you freeze your eggs in your late 20s, early 30s, and then you get married and you're now ready to have your child, but you're still having issues? Like, that, does that mean that it's still you, or could it possibly be your partner?
Thank you for saying that. I wanted to go back to that also, because we mentioned many female fertility factors, and it is a misconception that infertility is a female thing. We all see patients who come in and they say, I wanted to do all the testing for me, and if we don't find anything, then we'll test my male partner. And we say, no, 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 because we know that in couples, up to 40% of the time, there is a male factor, either as the only factor or in addition to a female factor. So we advocate for couples being tested. If there's a male partner present, he needs to have a semen analysis as one of the initial tests, the same way that the woman is having her workup. So it can be a combination of factors, and we cannot discount male factor as a real factor that contributes to infertility for couples where there is a male partner present. So if you freeze your eggs and then you're having trouble getting pregnant later on, then you can thaw those eggs and basically fertilize them in the laboratory, do the second half of in vitro, and have healthy embryos to transfer to have a pregnancy that way.
Thank you. So it's not just always a woman. Hello.
It is not.
It's really not. It's really not. And like, from the natural perspective, I'll just add that I will say like 60% of our couples have not had the male partner tested. And these couples have been on a journey for 2 to 5 years. They're not like fresh, like, hey, we can't get pregnant, what's happening? No, these people have been to fertility clinics, they've been to an OBGYN. And I'm like, in what world do we not stop and think, is it the guy?
Yes, like, you need both of them to make a baby.
We really do. And the quality of the embryo that you get is not just based on egg quality, it's also based on sperm quality. So there are a lot of factors that are underlying, even for men, if they have metabolic syndrome, blood sugar, dysglycemia, obesity, high homocysteine levels. There's a whole bunch of like factors that we're checking off to see if he has any of those. Even if his sperm looks good, he needs treatment. And they're often like, what? My doctor said my sperm were amazing. And I'm like, yeah, that's great. And if you want to get pregnant naturally, we're going to do all of this other stuff. And they're often like, wait, you're telling me I have to change my diet and lose weight and exercise? And I'm like, yep, you're going to do it too. You are not getting off easy.
And I know Dr. McCarthy Keith, you're a proponent of like that vegan lifestyle, incorporating a healthy lifestyle, healthy diet, and everything into your fertility for your couples. So talk about the importance of that.
Yes, I am a crazy vegan, and I think that everybody should, you don't have to be vegan, but we should all have more plants in our diet. We know that a plant-based diet is a healthier diet. And again, everyone doesn't have to throw out all the meat. You can have lean meat and fish, and you get protein from that, but that should not be the mainstay of your diet or the largest portion on your plate. And so we do always talk about the importance of being healthy before you get pregnant. If you are a normal weight and you have addressed any metabolic factors, you've got your blood pressure under control, you're in a normal weight range, then your chance of pregnancy with fertility treatment is going to be higher. Your risk of pregnancy complications is also going to be lower. We know that if women, first of all, obesity is epidemic in this country, and especially for women of color. For Black women particularly, 2/3 of us are either overweight or obese. Majority of us are overweight or obese, and we know that that affects everything from our risk of cancers to blood pressure, diabetes, fertility, pregnancy complications, and all. And those are modifiable factors. We can correct that with lifestyle, by healthy diet and exercise. We can do that. And so it's very important to have that foundation before you get pregnant so that you have less risk of gestational diabetes and preeclampsia, preterm delivery, and C-section, and all the things that go along with being overweight or obese when you're pregnant. So yes, I advocate for that. I talk about it with everyone. I share recipes with my patients and juice recipes and smoothies or whatever works for you. There's not a specific fertility diet, but I think that we can all benefit from just more fresh fruits and vegetables in our diet, less processed food, takeout, animal protein, and not just meat, but animal products like butter, eggs, milk, cheese, all raise your cholesterol. They have unhealthy fats in them. So we should all have less of that in our diet.
Well, thank you. I want to bring on, no, go ahead. What'd you say?
I was like, I love that we're both vegan, and we just happen to.
I'm not, but I appreciate y'all. But I do want to bring on Jocelyn and Stacy back to the stream now, because I do think it's really important just to hear again, from them and from all of you, what are your final words of encouragement for women that are tuning in, whether they're watching right now or they're watching the replay, how they can not feel like they have to suffer in silence when they have a diagnosis of infertility, to know that there's a community of people that are willing to support them. What resources do you all have? What are your final pieces of encouraging and empowering advice that we can leave with today's viewers when it comes to going on this journey that might start earlier or later than they expect, but something that they have to go on? So, Jocelyn, I'll start with you.
Okay. A lot of it, I think, is just kind of reiterating what's been said before. So Dr. McCarthy Keith and Dr. Amatma, I mean, if I had been blessed to know them, I would have gone to them, I mean, these are the people you want to find. So I think it was Dr. McCarthy Keith who said, you just keep looking. And that's what I did. That's what Stacy and I both did. I went to 10 different fertility clinics until I found a place where I felt good. So keep looking until you feel comfortable, until you feel like you're in a space where somebody's actually going to support you. It's really, really important. So I think that, keeping the good fight, and Stacy mentioned just keeping faith. Like it is a faith journey. So if it's something that you want to, risk the fear, because I think women stop because they get afraid. But I think the way I got to this point was to say, like, hey, even if this doesn't turn out the way I want, I will only regret not trying. And if that's how you feel, then muster up whatever faith you have to keep going.
Thank you, Jocelyn. What about you, Stacy?
Yes, definitely. I completely concur with what Jocelyn is saying. And, also, like I said before, you got to prepare yourself for, it is a journey. It is definitely a journey. and it is kind of a roller coaster of a journey. It can be. So just kind of prepare yourself for that as much as you can. Resource-wise, there's a lot out there. There's so much out there. And it's important to find, like both of our doctors here said, someone that you trust and that you feel good with. Don't get caught up in going to this clinic because, this is where the celebrities went, or going to this clinic because of their success rates. It is all about, the relationship with you and your doctor and how you're treated, also how they treat your partner. That's important because, one of the clinics that we went to, they wouldn't even address my husband barely.
Wow.
They barely, said hello. They barely would look him in the face, while he's in the room with me. And then also, there's just one of the websites that I went to often that was a wealth of information and, has a lot of great doctors with actual patient reviews is fertilityiq.com, and just has all kinds of valuable, information there. And then just, take care of yourself. As both of the doctors said, really take care of yourself. Make it make that your mission to be in the best health that you possibly can, mentally and physically and emotionally, because all of it is involved, on every level. So
amazing. Well, thank you, Stacey. And Dr. Matma, what words of encouragement do you have for the viewers watching?
I would say first, figure out what your intention is, right? Like, get really clear on, I think it was Jocelyn that was saying, like, if this is your deepest desire, get ready and like prepare yourself in all the different ways. I encourage patients to find that dream team of people. It's not going to be one person. It's going to be a team of people that are going to need to support you to get you to the finish line. And then 3, just on a practical tip, a few people are probably asking, like, what lab tests, where do I find the lab tests? So there's a company called modernfertility.com, I think they are. They're the at-home testing kit that they can send you. So that would be my practical tip. And I think we lost our host.
I think she was having connection issues. She should be back on in a sec.
Yeah. Oh, there we are.
I think she's coming back in. Well, then I will take my turn while Jumi joins us again. And I'll just say, I always tell my patients, all faith, no fear. And so you have to really trust in the process. You have to trust in the higher power and the purpose for your life and the purpose for whatever journey that you're on. It's important to connect with your team and to feel like you have advocates and people who are really invested in your success. Like I mentioned, it's so important for women to just plan for your life, plan for your future, plan for your fertility future, educate yourself. And I really love and appreciate this forum where Jocelyn and Stacey have shared their stories. And that is, you don't know how many women you help when you just have your face here and people can see women who look like them, who have had some of the same type of struggles. It is very important for us to use our platform and our voice to just remove the stigma and the shame, and just start this conversation and let people know that it's okay to talk about your fertility, to seek fertility treatment, and to take care of yourself, like we mentioned, both physically and emotionally, because this is a journey that you're on. But we're here to support you. And I always just remind my patients that you're worthy. And so if that is your heart's desire, then you pursue that and know that you have options to get there, and seek the people who can help you to do that. Yeah. And last thing I'll say, we'll shout out for a support group, which is called Fertility for Colored Girls. Is a national organization of support for women of color. It was founded by Reverend Stacey. It was done in Chicago, and now it is a national organization with chapters throughout major cities in the country. So there are support groups. There are women who look like us who can speak on this, on our experiences, and who can connect you with people who can help you.
Well, thank you all. Can you all see me? Am I here in real time? Okay, great.
You're back.
I want to say thank you all, Dr. Mccarthy Keith, Dr. Matma, Jocelyn, Stacy, the babies. Thank you all for tuning in throughout this entire time. Your information, your transparency, everything that you've shared today has been so empowering, so engaging. And I hope that everybody watching today that, has gone through their issues or knows somebody going through it or might be going through it feels very encouraged and empowered to know that they're not alone. You're not alone. You are valued. Don't ever give up on your dream. If it is something that you want to do, continue to pursue it, and it will happen for you. It will happen for you. So this has been another episode of Jumping with Jumi. Once again, thank you to all of my guests. I will see you all next week. Same time, same place, hopefully better internet. Until next week. Bye, everybody.
Bye. Thank you.